Hello, my name is Greg Lyle and I'm from the Public Health Information Development Unit at Torrens University. Today we're having a conversation with Justin Bilby, a general practitioner and health researcher for over 30 years, about a new evidence base that we have created across the whole of Australia on potentially preventable hospitalisation. Hi Justin, thanks for joining us today and talking about the potentially preventable hospitalisations project.
Thanks, Greg. It's a pleasure to be here and very excited to be talking through with the material and document you've recently produced.
Can you tell us a little bit about your background and experience with health data?
My name's Justin Bilby and I'm a GP, but a health services researcher and have been working in this area for almost 30 years. What I've learned over the years is the importance to visually describe how different regions, different areas in Australia are affected by diseases in different ways.
Thanks, Justin. Can you tell us a little bit about your experience with the data that PHIDU publishes?
What I've learned about all the issue of data and health atlas and social atlases, it's been fantastic to be able to compare and contrast different regions across Australia in a way that's usable, friendly, and basically allows you to help guide your clinical and your health service practice. What I like about the actual tool in the health atlas, it allows data to drive partnerships, maps to drive relationships, and collaboration to have a hard-nosed discussion about where we can make the biggest difference.
How important could this data be to inform decisions made in the health sector?
The potentially preventable hospitalisation analysis that's now been produced is rich beyond belief. The tools they've used to colour code and to heat map what's happening in different regions in Australia will allow health services, primary healthcare networks, local healthcare networks, and more importantly, GPs and primary care clinicians on the ground to focus very much where they think they can make the best difference around hospitalisation. That's the importance of this new material produced by PHIDU, and the value it is to the community is just extraordinary.
From your experience, how do you think this data will be used?
When you look at a heat map as a clinician or as a health services researcher, look at where the effect, whether it's chronic illness, other areas of potentially preventable hospitalisation. What it does, it sharpens your clinical care. It sharpens your health service models. It sharpens how you implement new policies in a region and allows you to think very carefully about what the next steps are to make the best value for the patients who you're trying to prevent to being hospitalised.
Specifically for primary care, what do you think the benefit is there?
The PPH and its value for primary care, it's a place where primary care and general practice are the most powerful. If you focus the thinking with the primary healthcare networks or other health services providers, local government, other not-for-profits in your region, you can build a strong coalition of partners to really make a difference in the way of preventing people being hospitalised. That's the value of this tool, the importance of the heat map, the ability to change and reflect. What I like about this is the material has been gathered over time. There's no point in committing and drawing people together in partnerships to tackle potentially preventable hospitalisations without being rewarded. Why spend hours in meetings and clarifying new policies and procedures without being able to assess it over a period of 3 to 4 years? That's the importance of this work. That's why I'm so excited to be commenting and to reflecting on how valuable it is to us as on the ground, but also more importantly, in building that key collaborative stakeholder partnership with the healthcare networks, both hospital and community-based, and building into the future.
How could this data be used to inform health services research?
What I like about it, though, when I'm having a meeting with a set of local stakeholders, where there's some funding that's appeared around diabetes or the diseases we're trying to prevent, you can actually have like a stake in the ground, like something you can peg a discussion to. You can use the atlas for your region to say, we're a hotspot for this condition. This is where we're going to focus for the next 12 months. But the importance of that, of drawing people into the conversation to say, we know we can work together in a way that will make a difference. We will decrease your hospitalisation. We can measure it. We can change the heat map, but we can build a collaborative approach, particularly with new policy initiatives. For example, care planning, the use of health assessments, the use of specific tools in the medical benefit scheme that GPs have access to can then link back to the area of where we can decrease the hospitalisations. In many ways, what COVID has taught us is the value of the collaboration partnerships as we've gone forward. And there's no doubt that the PPH model and its importance for the region is underestimated, not utilised enough. But the new atlas you've developed gives us a really good base to build and go forward in the future.
With this data created at such a high level, is there any benefit to the health practitioner?
Well, day-to-day GPs or primary care clinicians, hospital-based clinicians, the actual data is too far removed from their clinical care. You know, they're dealing with patients on a one-to-one basis. What it does do, though, for GPs, practices, and local health networks that want to bring people together, it gives you a framework to build a story that everyone can contribute to. What we really need to do, though, is to teach people how to use it, to educate people how to value the data from their region, and then empower the local health networks and the primary healthcare networks and the local hospital networks to work with like-minded clinicians who can see the bigger picture. Not everyone's going to do it, but many GPs love the fact they're part of a system that's responding. And as I say, the best example is the immunization is just through COVID. That is a journey. That's the importance of it, but it's very usable. It's easy to follow. You don't have to spend hours analyzing it, and the heat maps and the comparison with other region gives you a story to work off. So I think we're on a journey, but I think for many like-minded GPs and practices who like integrating their data, it is really very strong, and the potential is quite extraordinary.
Justin, you make a great point about translating the benefit of these data to local and primary health networks. After publishing this data, we've had several meetings with the Central Adelaide Local Health Network and the Adelaide PHN. And for the Adelaide PHN example, you can see how valuable this information is because it's filtering through to their needs assessments. You mentioned integrating local practitioner data. How do you see this being played out in the future?
Oh, I think it's just an evolution. What's becoming more apparent in general practice and my day-to-day practice is the value of our clinical record data, that if it's de-identified. The importance of the data in understanding where the best intervention is for your region, whether you live in the country or the city, or you live in a Western Sydney versus rural South Australia. What's becoming, I think, the power of clinical data, if well managed, much as you've done with the Social Health Atlas, will probably be the future. The future of our system, or the future of our care, will be run by how we actually use data to inform our practice, whether it's quality improvement, whether it's defining new policies and community engagement. That's how I see this is really the forerunner of where we can go. And I think it's about teaching GPs, if that's the area I know best, in their education programs, how you can use information to drive your change.
Thank you, Justin, for your time and sharing your insights into our project.
Thank you for asking me to do it. It's a pleasure. A real pleasure, Greg. Real pleasure.